Hello dear friends, how are you doing today? I hope you are doing well. Welcome to a new question of dermatology. A 30-year-old man presents with painful purple-colored lesions on his shins. Some of these lesions have started to heal and no evidence of scarring is seen. These have been present for the past 2 weeks. There is no past medical history of note and he takes no regular medications. What is the most useful next investigation? A. Liver function tests. B. Anti-nuclear antibody. C. ECG. D. HIV test. And E. Chest X-ray. Okay, here we have a 30-year-old man coming with painful purple-colored lesions on his shins. Some of these lesions have started to heal and there is no evidence of scarring. These have been present for the past 2 weeks, but there is no past medical history of note and the patient does not take any regular medications. Okay, the diagnosis here is Erythema Nodosum, and the most useful next investigation would be a chest X-ray, which we can exclude the two most important causes of erythema nodosum, which is sarcoidosis and tuberculosis. Here we are going to explain it. The likely diagnosis here is erythema nodosum. All these tests may have a place, but a chest X-ray is important as it helps exclude sarcoidosis and tuberculosis, two important causes of erythema nodosum. Erythema nodosum. Erythema nodosum is an inflammatory condition of the subcutaneous fat. Inflammation is concentrated in the fibrous septa that separate the aggregated fat cells or lobules, presenting as tender red nodules most commonly in the anterior shins. It is usually self-limited but often signals an underlying systemic disease. As we can see here, we can see the lesions of erythema nodosum. These lesions are usually painful and tender on palpation. Clinical features: lesions, painful erythematous raised nodules or plaques from 2 to 6 cm are present. Location: mainly on the anterior tibia, but also thighs, arms, and buttocks can be involved. Evolution: nodules change color. First, the nodules appear as red, then they change color to white lashes, and then to bruise-like lesions over 1 to 2 weeks. Systemic symptoms: fever, malaise, joint pain, especially ankles, and sometimes arthralgia and arthritis can be present. Healing: usually the lesions heal without ulceration or scarring, usually within 3 to 6 weeks. As we can see here, we can see reddish and white lesions of erythema nodosum on the shins of these patients. Also here we can see the erythematous and white lesions of erythema nodosum. Causes of erythema nodosum: multifactorial, often a hypersensitivity reaction. Infections: streptococcal infection, most common in children, tuberculosis, Yersinia, chlamydia, mycoplasma, viral infections like Epstein-Barr virus, hepatitis virus, HIV are the infectious causes of erythema nodosum. Systemic disease like sarcoidosis, inflammatory bowel disease like Crohn's disease, ulcerative colitis, and Behçet's disease are systemic disease which leads to erythema nodosum. Drugs like oral contraceptives, sulfonamides, and penicillins are the drug cause of erythema nodosum. Other causes like pregnancy and malignancies, rarely hematological cancers, can lead to erythema nodosum. Pathogenesis of erythema nodosum. Erythema nodosum is thought to be a delayed hypersensitivity reaction to a wide variety of antigens, infectious, drug, or self-antigens in autoimmune disease. Histology shows septal panniculitis without vasculitis. Diagnosis of erythema nodosum. Clinical: the diagnosis is usually clinical. Characteristic: painful red nodules on the shins. Investigations to find the underlying causes: throat swab and ASO titer for streptococcus, chest X-ray for TB and sarcoidosis. ESR and CRP are usually raised. Stool cultures for Yersinia, inflammatory bowel disease workup if suspected. Other tests guided by history, example pregnancy tests, HIV and hepatitis, can be useful treatment. Treatment is usually a supportive mainstay since erythema nodosum is often self-limiting, like bed rest, leg elevation, NSAIDs for pain and inflammation, and compression stockings if needed. Treat the underlying cause. Antibiotics for streptococcal infection, anti-TB therapy if TB is found. Corticosteroids may be used in severe refractory cases only if infection is ruled out. And this is an important note. Corticosteroids are useful, but we must first rule out infectious causes. Prognosis of erythema nodosum. Prognosis is usually, the lesions usually resolve in 3 to 6 weeks, but recurrences may happen if the underlying disease persists. Okay, this was a short explanation about the erythema nodosum, presentations, causes, and the management of erythema nodosum. Thank you for your attention.